Let's talk about the uterus after giving birth. I recently did a video about how the uterus contracts because of the release of oxytocin while the baby is breastfeeding to get back to its normal size, and I wanted to just go through that a little more in depth as I'm learning more. I'm currently a nurse studying lactation, and I share kind of the things that I learned along the way. So the uterus size actually changes pretty rapidly after birth. It starts contracting down and it gets down to the level of your belly button pretty much immediately after birth, and then slowly goes down even further. And like I mentioned in the last video, the baby breastfeeds, which releases oxytocin, so does skin to skin and other things, and that causes the uterus that is pretty big after you give birth to start contracting down to its normal size. It may not go exactly back to its normal size, but it needs to shrink back down, and it can be pretty painful. So have you ever had a nurse who pushes down by your belly button to kind of feel where the uterus is, and then sometimes they actually really get in there and massage the uterus really deeply? That is because if your uterus is boggy, which means that it's not firm, it's not contracting as well, and that could cause increased bleeding. So what the nurses do is they massage it really deeply to help contract that uterus and firm it up. You should also note to have your bladder empty before they do this, before they check where the fundus is, which is the area at the top of the uterus where that is located, because it can make the fundus higher if your bladder is displacing it, but your nurses should know that. And also just a little extra tidbit in regards to breastfeeding, because I know this does cause a lot of pain. The more pain that you're in after you give birth, the less likely you are to have letdowns when you breastfeed. Let me know if you found this interesting and what else you would like me to cover.